Insurance coverage and coronavirus frequently asked questions. The Pennsylvania Insurance Department developed this information to address insurance coverage questions about coronavirus. Health insurers play a critical role in the public's ability to get health care services, which could help decrease the spread of the virus. Coronaviruses are a large family of viruses that are common in people and many different species of animals, including cattle, cats, and bats. Coronaviruses can spread like a cold. The new coronavirus is called novel coronavirus, COVID-19. It causes respiratory illness in people and can spread from person to person. This virus was first identified in Wuhan, China. Where can I find more information about COVID-19? The Pennsylvania Department of Health has a dedicated webpage for COVID-19 that provides daily updates. View the most up to date information on the Department of Health's website at www.health.pa.gov. How do I know if my insurance will cover testing and treatment related to COVID 19? All major medical, Affordable Care Act compliant plans, including those available through the federally facilitated marketplace, www.healthcare.gov, should cover medically appropriate COVID 19 diagnostic testing and associated treatment. Many insurers have already announced that they will cover medically appropriate COVID 19 testing without any copays, deductibles, or cost sharing for consumers, and the department encourages patients to be aware of steps their insurance company is taking to increase access. Medical assistance covers medically appropriate laboratory testing for COVID 19 without any copayments. Associated treatment for COVID 19 is also covered, although there may be a nominal copay. If you cannot afford the copay at the time you receive the service, you will not be denied treatment, although your provider may send you a bill for the copayment amount. Accepted benefit policies, short-term, limited duration health insurance coverage, and/or healthcare sharing ministries can have significant limitations on coverage and may not provide the same level of access. If any consumer has a question about their insurance policy, we encourage them to contact their insurer and welcome inquiries to the department's consumer hotline at 877-881-6388. Who pays for COVID 19 diagnostic testing if needed? The Federal Centers for Disease Control and Prevention, the CDC, and the Pennsylvania Department of Health are currently performing tests without charge for COVID 19. However, commercial labs are in the process of implementing testing capabilities, and some have begun to perform tests. Hospitals and providers are expected to bill insurance companies for the fees associated with collecting the specimens, and labs are expected to bill for the costs associated with the actual testing, which then could be billed to the patient or to the patient's health insurance issuer. Many insurers have already announced they will cover medically appropriate COVID 19 testing without any copays, deductibles, or cost sharing for consumers, and the department encourages patients to be aware of steps their insurance company is taking to increase access. Pennsylvanians receiving Medicaid coverage will not be expected to pay a copay for any testing related to COVID 19. What if I have health concerns that require emergency medical services? In the event emergency medical services are requested or needed by individuals who have contracted COVID 19 or believe they may have come in contact with the virus, insurance carriers must cover emergency services for an emergency medical condition at in network levels. Emergency services include transportation services, such as ambulance services, as well as inpatient and outpatient hospital services that are needed to evaluate or stabilize the patient. Medical assistance covers emergency services, although there may be a nominal copay for certain services. If you cannot afford the copay at the time you receive the service, you will not be denied treatment, although your provider may send you a bill for the copayment amount. Can my insurance carrier cancel or refuse to renew my insurance policy if I am diagnosed with COVID 19 or a pre existing respiratory illness? No. The Pennsylvania Insurance Department prohibits individual or group accident and health insurance carriers from imposing any pre existing condition exclusions, including in connection with COVID 19. Federal law and state regulations provide protections against pre existing condition exclusions in health insurance coverage as well. However, pre existing condition consumer protections do not apply to short term, limited duration health insurance coverage or accepted benefit policies. Is there a number to call if I have questions or need help with my health insurance? Yes, the Pennsylvania Insurance Department has a team available to answer questions about insurance coverage and benefits at 877 881 6388. You can also contact the Pennsylvania Insurance Department if you received an unexpected bill related to COVID 19 or other health care services. Is there a number to call for Medicare beneficiaries and caregiver inquiries? Yes. If you have questions regarding Medicare beneficiaries and caregiver inquiries, please call CMS at 800 548 9034. Is there a number to call if you have medical assistance or CHIP coverage? Yes. If you are enrolled in medical assistance and have questions regarding coverage, contact your managed care organization or the Fee for Service Recipient Service Center at 1 800 537 8862. If you are enrolled in CHIP and have questions regarding coverage, please contact your CHIP insurance company or call 1 800 986 5437. For more information and resources, visit the Pennsylvania Department of Health website at www.health.pa.gov or the Centers for Disease Control and Prevention website, www.cdc.gov.